Good afternoon. I'd like to call the Board of Health meeting to order today at 4:30 p.m. If everyone would please rise for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Okay. So first up on our agenda is the new Community Health Coordinator, Laurie Keefe. If you'd like to, you can come up to the table, have a seat. Thank you so much for being able to come.
Yeah, thank you for having me.
So I know I've had communication with you, and I'm aware. I don't know if you. Okay. Okay. So I'll let you just give a whole overview of who you are, what you do, and what you're hoping to do for us.
Okay, so I am the Regional Community Health Coordinator. So the towns include Webster, Dudley, Oxford, Auburn, Southbridge, and Brimfield. It's right now, so I started in mid-October. I've already applied for a grant. If we get that grant, that would allow me the resources to do community assessment surveys. So that's kind of where I'm headed right now, creating surveys and asking a lot of questions because there's a lot I don't know about your communities. I feel like I'm so loud.
That's okay.
Oh my God. That's okay. There's a lot I don't know about each community. So if I send a lot of emails or if I ask a lot of questions, it's just because I don't know what I don't know. And if you don't tell me what your community needs, then I don't know what they are. So I kind of put together a quick 5-question survey that I sent out. Some people didn't get it. I sent it on Google Docs. It's not the best form of survey. Hoping to get SurveyMonkey up and running because that's a much better form of survey. But that 5 questions will just give me an idea from the members of the community, of the boards of health, or if you want to send that survey off to your town administrators or anybody who might be able to give me information. It's just your interpretation of your community. So what are the 3 biggest areas of concerns in your community? I know that another community had answered me the opiate crisis, hoarding, and teenage pregnancy were 3 big ones in one town. So I need to know that from every town in order to get a kind of good idea of how I can help each town. And in the meantime, I'm working on that, but if there's anything that you need from me, you need to reach out to me because I don't have a crystal ball. I don't know what you need if you don't tell me what you need. And keep that communication open. Anything. You want to ask a question, you want to have me over for coffee, anything.
So I'll give you a little, I should have introduced who we are so you at least know who. I'm Jennifer Canoyer. I'm the chairman currently. I've served on the Board of Health.
And forever.
Currently. I've served on the Board of Health for 12 years.
That's funny.
Thanks. To my left is Roberta Johnson. She is a Board of Health member and she's also our public health nurse. And to my right is Lori Dusham. She is our public health member.
Board of Health
member. This is the first we've ever had a public health nurse directly to ourselves. We've always been, prior to having Roberta, we were associated with Harrington Hospital, and then we had another health nurse that did multiple
towns.
Yeah. So we're very passionate about our town. I think.
Yeah, I think so. It's a good word. We try.
We like to be involved. There's so many different things we want to do. We've just never had the resources or
the backing too.
Right.
Yeah.
Right.
I think the
So
support.
a lot of my job is going to be communication and resources, providing those resources. How can I bridge the gap between you, the community, the municipality, and the resources that we have out there? So I'd like to bridge that gap and try to get as many resources into the community as we can. I know I don't know a whole heck of a lot about a lot of the areas from Blackstone. But I will tell you that my son spent 4 years in Dudley. He went to Nichols College. He graduated this past May.
My son did too.
So I did spend some time here, mainly for rugby games. So I would stop at Panera in Webster and make my way to Dudley for the games.
We're going to have more to offer in Dudley real soon. So
We're
that's what we're
hoping.
trying to do.
Yeah.
Well, that's what I'm hoping too.
Yes.
That's what I'm hoping, to bring more resources here. Any kind of resources we need. What are the needs of the community? So
We do work very closely with Nichols College.
Mhm.
We have a very good relationship with them, especially during the whole COVID episode. Ro was in touch with them probably daily
Yeah.
with PJ. They're wonderful with us. We're fortunate to have them,
yes,
but it is also another age group to consider
right.
for different
Another
things.
neighborhood almost.
Yes, yes.
Yeah.
We do have Joshua Place, which is a senior housing,
Right.
which we are very concerned about. We worked closely with them,
Yeah.
providing the vaccinations during COVID. We do have some hoarding situations.
So my experience is that I was a senior center director for 10 years. I was also chairman of the board of the Housing Authority in Blackstone. For a couple of years, I was the governor's appointment. Seniors are a passion of mine and are always one of the highest groups, one of the highest demographics in need. And I recognize that need. And I know there's a lot that can be done. And I know senior centers played an integral role during COVID, because for me, my whole role changed. We went from bingo and lunches to vaccinations and making sure people in isolation had what they needed.
Yeah.
And then combating that isolation that kept them
Right.
stagnant with nothing. And trying to get people out of that right now. And it's still a work in progress. So how can we do that?
I did look through your survey quick. I haven't had a chance to send it off to you guys yet. And I quickly, I was like, yep, one of my things is the seniors.
Mm-hmm.
That's one of our big things, I think, in town, is getting information to them.
Right.
And lack of technology
Yeah.
Right.
with seniors.
Right. So there's a lot of grants out there. I'm an avid grant chaser, so I can chase grants all day long. One of the things that I did when I was in Blackstone as a senior director was I applied for a grant that allowed me to buy 30 Amazon Fire tablets, and we used them as a lending library. And the one way that we could let them have them is if they agreed to Zoom with me once a week on those.
Oh, that's great.
So we had like a little coffee talk.
Yeah.
So it's just an idea, but it got them involved and it got them accustomed to using the technology, and being able to get that technology was the biggest.
Exactly.
During
boundary.
COVID, we had a vaccination sign-up list, which was online. All you had to do was go click, and we also set up a telephone number, and we were fortunate that we had some Board of Health assistants during that time, that all they did all day was return phone calls
Mhm.
to help them set up appointments at Harrington.
Yep. I've
And-
been there and done that. Yeah.
It's
Yeah.
well, it's
So-
not quick.
Right, exactly. So I think my point is that in the big picture of things, I need to know what are the areas we need to work on. But also, if we have a project like that, like, we need to get this done. We need to get these appointments made, and we need to get it done now. Who can we call that can help us with that? That's me. So I can
That's
help with that.
excellent.
I just spent the weekend making 50 appointments for the town I live in, even though I don't work there anymore. But they know me, and they know that I know the people, and they know that I know how to do it, and I know how to get the job done. So I did that, got that out of the way for them. So those are the little things that are important little things.
Mm-hmm.
So not only the big picture of things, like I sit and I look for grants, and I've tried to figure out surveys and how I can do the assessments on each town, but the little things too. We have to keep those in mind. Like, how can I help on the daily?
Absolutely.
Mm-hmm. Yeah.
Do you have any questions?
No, I don't think so. I think we might want to go over that survey
Brainstorm.
and
Yes.
brainstorm what we want to put on it.
Yeah,
But I don't want
yeah.
you to brainstorm on it. I want you to answer it individually.
Yep. I'll
because
send
I
you-
want different answers. I want your honest opinions and your different answers. So what you think might be important may not be as important to her, but it's just going to be, I'm going to just assess them as they come in and say, you know, what do we need to look at first?
Right, because you don't, like you said, you're not familiar with the areas.
Yeah.
We know the town,
Yeah, so as many eyes I can get on it, as many answers as I can get, the better,
excellent.
as far as I'm
Well,
concerned.
very happy to have you aboard along.
Happy to be here.
You know, any type of outreach, any type of is essential to boards of health.
Yeah,
Definitely.
you have all my contact information, my phone number, my email.
Yes.
Reach out anytime you want.
Thank you so much. It was
Thank
very
you.
nice to
Nice
meet you.
Lori.
Thanks for having me.
Look forward to
Yeah.
this. It'll be good.
Appreciate it.
Be great.
Doing a
Thank
good
you.
thing.
Thank you.
It's very exciting.
Oh, I'm already writing notes.
I know, the wheels are turning, we got some plans.
You don't know what you just asked for.
Yeah,
We're
watch
three very passionate people.
Well, that's what I like, so.
Thank
Have a great
you.
night, thank you.
Okay, number 2, we'd like to take the moment to introduce our new health agent, Camille Griffin. Camille, you've been with us
Over a month.
over a month. We have not met, that's why you have
Yep.
not been here.
Yep.
So, I'll give everyone that's here and watching at home a little background. We have an intermunicipal agreement with the town of Webster, so you work for the town of Webster, and you work a little bit for us, which we greatly appreciate. I'll just have you introduce yourself. Have you met Camille?
I have not.
We've
Hi,
not met.
Lori Ducharme, nice to meet you.
Nice to meet you as well.
I'm a local business owner in Webster, so,
Awesome.
yeah, this is exciting.
Yeah.
I'm glad for both towns,
Yes.
absolutely.
So a little bit about me. I was a public health inspector for the city of Framingham for over 4 years. It was a large community that had a little bit of everything. They always joke that it was in dog years for how long you served there. I finished my Master's of Public Health from Boston University back in June. And I'm just very passionate about public health. I'm very eager to get, both communities on the right page, getting, outdated forms updated, and really making sure that our processes are streamlined.
Great. We're very happy. I know when you came aboard, we had a couple issues right off the bat.
Yes, you did.
Not
What better way to jump in, though,
Not
right?
little. No, they weren't little issues. They were,
What better way to jump in?
Here you go. And
Welcome.
Yeah.
Yeah. Oh, here you go.
Give you a little taste of what Dudley's like. No, everything I've spoken to you on different occasions. Everything that you're doing has been great, amazing. If there's anything you need from us, let us know. We are, I'll repeat it again, we're very passionate. We're the ones that somebody will see on the street, or Lori will get a client, or Ro will get a phone call, or I get a Facebook message saying, hey,
Hey.
I just heard this. And all we want to do is just keep us in the loop, and we appreciate that, because the worst thing in the world is when we go,
I didn't know.
I didn't know.
Mm-hmm.
God, I didn't get that memo.
Something happened at Cumberland Farms and we didn't know about it. And that's the worst thing, when you're out somewhere and somebody's like, hey, I heard this, and you have that deer in the headlight look, and everybody thinks you should, and all we want to know is the big stuff.
Yep.
The little stuff, that other stuff, we know, you just deal with that. That's all good. But and I know you've been going through everything. I appreciate that. We do have we are getting up into online, which is exciting, and getting things. Have you gotten your iPad or tablet yet?
Not yet.
Ooh.
But you are getting one, which
Awesome.
is very
Ooh.
exciting. I'm just,
No more paper.
no, we're trying little by little. We're getting there. So that's
Sure,
very
that would make the
exciting.
process a lot easier.
Yeah.
Awesome.
Yeah, I mean, if restaurants can come and take your order with an iPad, why can't you do your job?
Right.
In your job, even if you have to, like, get information quick and not have to.
Because we're a little.
Dudley.
We're
Little.
Dudley. We're
Well,
a
that's
little-
all right, baby steps.
We're getting there.
Baby
We're getting
steps.
there.
I know that.
Do you have any questions for Camille?
I don't think so, no. It's been good, communication's been good, so I know how to find you, you know how to find me, so it's been good.
Yes.
Yeah.
Beautiful.
I'll connect with you once the holidays are over, because I have
Sounds
my
good.
own thing.
Okay.
Her own thing, that's on the
my own
thing.
sidebar, okay.
Salons, so that's my gig.
Yes. Yeah,
That might be revisited.
I think I told you that your husband was on the board at the time.
Mine?
Yeah.
Oh.
When we
Yeah.
implemented nail salon regulations due to the horrible things that can happen when you go
Just in
to
general.
an
And it's gonna, I've heard it's heading down that road anyway, where public health is gonna become a bigger part of salon inspections. You know,
Something else
not
for you to do.
next year, but eventually. Yeah.
Dudley's not bad. We only have one
wild.
mill.
Okay.
Webster, I'm
working
so
on it.
sorry.
I tried in Webster. I don't know if you had heard or talked to anybody, but we tried to get some of that, but,
Yeah.
but I'd like to revisit that, and I think you might be the right person to, yeah.
So, do you have any questions for us?
Not right now.
Okay. Anything upsetting? Everything going well?
Everything's going well. I have a couple things during like the
Perfect.
agent report. but I
Perfect,
can
okay.
hold that.
But in general,
Yep.
perfect, okay. All right, moving on to number 3, accept the minutes from the September 21st, 2021 meeting.
I make a motion to accept the minutes from the September 21st, 2021 meeting.
I second that motion.
I have a motion and a second. Any other discussion? Seeing none, all in favor? Aye.
Aye.
Passes unanimously. Number 4, COVID protocols discussion. Okay, Ro.
Well, I don't know. I think we kind of wanted to revisit that and see what your thoughts were. I'll just lump my stuff into this.
Yep.
We only have 24 active cases.
Okay.
There's a mix of adults and there's a mix of students. But I'm not seeing anything different from when the pandemic was at its peak. Still was kids, still were adults. Where they got it, home, out, etc. We have more people vaccinated. You know, the next age group just was approved. So we'll probably start to see that slow down in the schools. You know, there's the age group 5 to 12-year-olds. Those are the numbers, right? But even here in town, like, yeah, I might get 7 in a day and none for a little while. I'm just not seeing enough to support mask mandates again or making some changes. So we've kind of been talking a little bit about that to see what we should do. Yep, we're going into flu season. I haven't seen a lot of that come through yet either. So I think that's just in the back of my mind. You know, we had town meeting, on the 26th? We had one, you know, last year when it was the peak of it, right?
Right.
And we didn't have any breakthrough. We didn't have any cases come through, so we did a really good job. Was it because they were doing different protocols for cleaning at the time? I don't know. So I guess that's my thought. That's what I want to kind of revisit. Maybe we can have a discussion about that to see what we want to do for town hall. I don't want to make people provide their card or mandate masks, you know, but I think it's just something to kind of think about and talk about. What do we want to do?
I'll give you an overview of currently what's done here. We all, not all of us, 3rd floor were all single occupant offices. There's just one of us in there. Occasionally you may have another person in yours. But for the most part, 2nd floor is 2 occupant offices. Behind the plexiglass, that's been left up.
We still have that up, right? Yeah.
Yep, that was never taken down. As for cleaning, we don't have, I don't want to say we don't have, but we have someone from the highway department who comes in the morning, you know, empties our trash, sweeps the floor, basic stuff like that. Any cleaning of your own office space is kind of up to you. You know, like I have wipes that I'll wipe down my counter, or Lysol spray that I know you do. You know, you kind of take care of it on your own because we don't have a per se full-time maintenance person here,
Yep.
right?
Yep.
it's the highway department that covers it. So during the height of the pandemic, we did spray. It wasn't every day.
It wasn't, I think we did.
Twice a week.
Yeah,
Twice a week.
twice a
We
week.
switched because we were all.
Alternating schedules, right.
Yeah.
So it was sprayed twice a week. And that was during the height of it when we always were here and open, well, not open, but we were always here. We had a kiosk drive-through. But we alternated schedules so that not all of the employees were in the town hall at the same time.
Yep.
Some of us were here. When you weren't here, you were working from home or from another location, depending on what your setup was. So I don't know that, we're not in a height of a pandemic, I don't feel. I don't think our numbers, I think there's still, absolutely, there's still COVID, it's still going on. I understand flu and cold season is coming. I don't know that, I don't necessarily think we have to go back to the spraying like the height of the pandemic. And then, so how
Do you think just making more, just reiterating it's cold and flu season, so wash your hands, wipe surfaces down.
And I certainly want to be
if you're not feeling
proactive.
good.
Right.
I don't want to do it after, then we have a break on, like, oh my gosh, we
Let's
should
just
have been.
remind everybody,
Right.
don't get lax, let's, this isn't, it hasn't gone away, let's just reiterate the current, standards that are there, like,
and then
I don't feel good, stay home.
I don't know, this would be another, if we decided to go down that route, then I have to speak to our town administrator as for where do we get the money for that? How do we, you know what I mean?
Are you talking about the town hall? or-
Yes, just the town
The
hall.
town hall,
Yeah, or I should say municipal buildings.
municipal buildings.
So I definitely think that if you and Camille can brainstorm and think about what you think is good, 'cause
Yeah, I mean, it would be not a bad idea to have a discussion.
Sure.
Or we'll take up the whole meeting on that, because we certainly could,
Right.
but, and it's almost Thanksgiving, so we're not gonna have that many staff members in the building, right? And then Christmas is coming. So those weeks might be a good time for us to do some sort of deep cleaning. I don't know, but this is a discussion we can have,
Sure.
So I started thinking and was like, should we be doing something different? What should we do? What are your thoughts? You're in both towns.
Yep.
So,
I think what maybe Amanda and I can do during the day over the next couple days is make sure everybody has full hand sanitizer. We have some wipes, make sure everybody has their wipes. If they're in a spray, if they need it, if not, then we can get it through highway, they'll order
Okay.
some.
yeah.
Through two, I'm sure two would help us get that. So maybe just to, at this point, say, and then you guys can have, by all means, please have your discussion, but at least give them that, this is what you're gonna do, Unfortunately, we don't have a full-time maintenance person, so we do have to, I dust my own office, I wipe down my counters. It's no different than being at home, in my
Yeah.
opinion, So we'll make sure of that at least for,
Okay.
does that sound good?
Yeah, and maybe, I think we had it here once, how, I've seen it in places like clean pens, dirty pens.
Yep, I know they do that at the
You know.
town clerk's office, I've seen that, I've seen it on the counters that have the pens
Yeah.
out, absolutely. We will, if we work on that, we'll be good. Okay, anything else from you?
Mm-mm.
Okay,
No,
all right,
Sorry, hot flash.
okay, no, that's okay. Up next will be the health agent report, comments.
So, I did start here at the very end of September, for my time in Dudley. In that time, we received 5 housing complaints, 4 of which were investigated because 1 was withdrawn. Some of those were pre-existing prior to me coming, but they were handled. We did receive 1 nuisance complaint that I have inspected and sent some order letters out on. We did receive about 15 temporary food applications and 8 annual food renewal applications so far. For the applications, I just kind of wanted to talk to you guys about I'm gonna be helping update the application forms,
Thank
just
you.
so that way we're asking the right questions. There was a couple of, technicalities of saying, you're acknowledging that you're working in the 1999 food code, but Massachusetts updated to the 2013 back in October of 18. So we just want to make sure that, all of the business owners are aware of what the current regulations are that they need to be following. For temporary food operations, this came in light of an upcoming event that one vendor reached out and said to ask clarification on the requirement for a food permit or a temporary food permit. And after doing some research, communicating with other municipalities, and going all the way up to the state's Department of Public Health Food Protection Program to get some answers, it was determined that prepackaged non-TCS food products do not require a food permit.
TCS.
So time temperature control for safety. So if it's anything that would either require refrigeration or hot holding, so if it's a shelf-stable item that's already prepackaged, it technically doesn't require a food permit. There are pros and cons to this. The pro is that local municipalities can come up with their own bylaws or Board of Health regulations that say, even though the food code doesn't have your operation as the definition of a food establishment, we as the town of Dudley may still want to permit them and go through that process and say, you're still serving food, you're still selling food. We want to have, oversight of that. The sticky part for this is that some of the operations that have already applied for this temporary event, we've already signed off on their permits. So some of them have applied because we didn't know this information prior to signing off and receiving those applications, because they've kind of been coming in here and there. Part of it also included residential kitchens, because residential kitchens are only allowed to make non-TCS food, so it has to be shelf stable, it cannot require refrigeration. If they are permitted as a residential kitchen in another municipality and they are pre-packaging their product and putting their little cookies in a little Ziploc bag, that is then not requiring a permit here, unless we came up with local regulation.
Interesting.
Yeah.
So somebody who bakes cupcakes and things like that, they don't have to apply for it?
Correct. So it's going to be, it's going to be a challenge for people looking to have hold a craft fair, like an event organizer. It's definitely going to be challenging, and there's probably going to be, who has the deciding factor of what qualifies, what doesn't qualify. It's going to probably bring in more phone calls to us, so it will be a little bit more heavy on the administrative work to then determine, nope, you don't need a permit. So there are some benefits to having some local food regulations. In the city of Framingham, we did have local regs, so we put all food establishments into a risk category, anywhere from 0 to 4. So the zeros were these prepackaged, limited retail, simple operations. We would only do an inspection if we received a complaint, but we would do an annual phone call to make sure that they weren't now selling milk or any sort of prepackaged sandwiches, things like that. For the risk categories, category 4s would be any sort of nursing home, sushi establishment, high risk operations. Other things that Framingham included in their local food regulations was, if you had any amount of seats for indoor seating, you needed to have a choke safe, because the current state regulations and FDA regulations say if you have 25 seats, then you need to have someone choke safe. But if you have 24, you don't, because no one's going to choke if you only have 24 seats. Oh gosh. So I'm, a big advocate to make sure
Person to choke.
if you have one seat, you need someone trained on how to perform
Do
the
the
Heimlich.
Heimlich.
Yep.
That almost should tie in with just the serve safe stuff. I mean, somebody from an establishment should get that anyway.
Right.
Yeah, absolutely.
I mean, if it's a convenience store and they don't have seating, then,
Yeah.
Right,
Okay.
but,
right.
yeah,
But
the ones
any-
that do.
We have a couple that do have that, so.
Yeah, so it's things to consider. I'm happy helping draft up some local food regulations. Again, it's very supplementary to the existing state's food code that's merged with the FDA 2013 food code. Again, it's just adding a couple of extra protections here and there.
Yeah.
So that is definitely something that we could consider.
Absolutely. Absolutely. Sorry. Yeah, I didn't
I don't think we
realize
knew
that.
that.
So those are things that definitely would concern us. So
Yes.
absolutely, if you would
Okay.
like to work on those.
I can certainly work on some of those. One of the other things that I've noticed was we currently are combining for our permanent food establishments, we're combining both our food and tobacco applications and permits all in one. I think that we should separate them because if someone had, a lot of tobacco violations and we needed to revoke their permit, but they still are able to sell food,
They'd lose the whole thing?
right.
Okay.
I mean, I think it's probably more of a technicality that you could like edit it, but still
Absolutely.
for purposes
Yep.
like that. Our current application because we are in renewal season right now, our tobacco application is pretty outdated, and there is a list of criteria that our applicants are signing off, acknowledging that they are complying with the current rules and regulations, and it kind of gives a summary. The current application says that they're not going to sell to anyone under the age of 18. The state increased that minimum age to 21.
Oh, see.
And the fines for the state regulation is first offense is $1,000. Our current old outdated application says first offense is a written warning.
Okay.
So
Yeah, that
again, it's just increasing, updating the applications and making sure that the outreach to the establishments, because especially regarding the tobacco,
Right.
those are some pretty hefty fines for first offense. And so just making sure. I did reach out to the Tobacco Control Program, who has gotten me in touch with the Leominster Tobacco Control Alliance, who Dudley is a part of. I'm waiting to hear back from them to kind of see what sort of outreach has already occurred here, particularly with the updated tobacco regulations that came out in like 2018 and 2019 timeframe.
Yes, if you could do that, and then work with Amanda on that, getting
Yes.
things nice and cleaned up. And then I think perhaps what we should do is anyone who's already applied, just send them out another notice
Yep.
saying,
Here's
we
some
have since
updates.
updated, just be sure, blah, blah, blah.
Yep.
Mm-hmm.
Yep, that's
Does that sound
easily
right?
done.
Mm-hmm.
I think for right now, that's pretty much it. I know in the past, I did not see anything on the fee schedule regarding frozen dessert licenses, which is its own state regulation, that we would issue frozen dessert licenses for retail or wholesale for manufacturing. Pretty much making frozen desserts at a wholesale level is the only thing that the locals have jurisdiction. All other wholesale is handled by the state, except for frozen desserts. So we would have, oversight for that. There is, monthly testing requirements to make sure that the bacteria counts are coming up for both soft serve and hard serve ice cream. So just kind of getting a process in place for that. That regulation states that the renewal, I believe, is the end of February. I will
Okay.
double check that, but again, it's something in the process to revise the fee schedule, just so we have a fee that we can then charge with the application.
So that'll affect one of our businesses in town.
Yeah,
Yeah, because the other place on Schofield, I don't think, did they have
They
soft
used,
serve?
they used to, but I think they stopped.
Okay, so it's really just
And
up the street.
I believe Nichols,
I think I saw something that they were sending the lab samples.
that's
so
what I thought, okay.
Well, yeah.
And you're coming Monday?
I did not know it was rescheduled, but I can try.
Yes,
Okay,
I think I sent you guys a text.
okay.
Yeah.
Okay. We
We're
can,
just gonna meet with
Yeah.
PJ to meet
Okay.
the new nurse,
okay.
and
And-
there's a new food director too, so.
So I
Which
can
would be
get you,
important.
Yeah.
Perfect.
yeah,
Yeah.
because they were supposed to reach out
Thank you.
and I have not heard, so
Okay.
we will.
Yep, sounds good.
Absolutely.
Interesting.
So I think that that's all I have for now.
Okay, and with talking about the fee schedule, and then have you looked at our fees? Are they?
I have.
Our fees are old.
They're not the worst that I've seen from other communities.
Send it to
So
us
it's all
later.
a work in progress. You know, I think that there could be some revisions made. Again, one goal that we had in Framingham with putting our restaurants into risk categories was actually going to be changing the fee schedule associated with the risk.
Makes
Because
sense.
currently they are similarly saying, oh, if you have less than so many seats or square
Right.
footage, like that doesn't show you how much hazard there is in their food preparation and, you know, the amount of effort that it takes for how often are you inspecting them. So there's a lot more work depending on how risky of a food operation it is. So being able to charge them accordingly of, you know, the
Seems-
nursing homes and sushi or any sort of special processes should be getting inspected 4 times a year. That takes up a lot more staff hours and everything. One benefit to also putting them into the risk category is there is somewhat of a benefit to them because you can change their risk category based off of good behavior or bad behavior.
Okay.
So, you know, if a food establishment that, you know, is a pizza place and is usually inspected twice a year, but you're finding a lot of problems, you can bump them up to a risk category 3. And then if the fee was associated, they have to then charge more for their application because they need more work.
Okay, so, not till after the first of the year, because we'll
Yes.
go with this.
Oh, yep.
But will you be able to work on that for us? Because
100%.
that is definitely something that
Oh, yeah.
we all are in favor of.
Absolutely.
Yeah, yes, because that would possibly help with a couple establishments in town. We'll just leave it at that.
Yeah, yeah, so we can definitely put the fee schedule for the restaurants at least for next year's renewal
Absolutely.
season. I don't want that to affect, you know,
Right,
the existing
this year we'll
renewals.
go forward.
But we can certainly talk about it, and if we have to put a future effective date, then that's not a problem.
Perfect. Question, during COVID, we had two bars that started to sell food.
Okay.
Um,
Because they were required to, because they couldn't sell alcohol without food.
right.
Yep, got it.
I'd like to give you those names off camera.
Okay.
Because I don't want to draw attention or anything, but I'd like you to look into them.
Okay.
Because we were just, I don't want to say uncomfortable, what were we?
I don't know, off camera.
It was just, it was a new situation to us, let's put it that way, so we didn't know what to do.
Yep.
Yeah, it was just, yeah.
It was a new situation for
A lot of people.
yeah,
Right,
a lot of
so,
Absolutely.
and, no problem with it,
Yeah.
but we just want to make sure that it's done proper, safe, blah, blah, blah.
Absolutely.
It was
Okay,
temporary,
Okay.
and the temporary's gone now.
so we're just,
So,
We just want to revisit that and
Yep.
see what your thoughts
The
are.
right
Okay.
word, I was just gonna say.
Sure.
excellent. Okay, nothing else?
Nothing else.
Okay, moving
You're
on.
busy, girl.
I know, I'm
Sorry.
so sorry, but
Jumping in,
thank you so much for all that you're doing, and I
hope Webster appreciates you too.
And I told you, if you have any issues, you can reach out to any one of us, you know, or Amanda, anything. We're usually all available
Mm-hmm.
all the time.
Yeah.
So,
Text away.
okay, no public left, so that's no public comments. Any board comments? Ro, do you have
We
anything?
haven't met since we had our bike rodeo, have we?
Yes, we
Oh,
did.
I can't remember, gosh, I don't remember
Yes, we
October.
did.
Did we?
It's on the
Your kids
bicycle
had so
rodeo
much fun.
event
That's right, we
recap.
recapped
They
it.
loved
We
it.
recapped it.
Yes.
How about the Spooktacular?
So,
Oh, yeah.
that was really fun.
That was a
Sorry,
lot of
I
fun.
missed most of
Well,
it.
that's all
sorry.
right.
That's all right, you came, so we had, October 28th, we had this was our third one, Halloween Spooktacular. We couldn't have one the year before. Everything was done outside. They do a parade up from the library up to the town hall. It's so cute. Oh, the kids are in their costumes, are adorable. We had scarecrows on the front lawn, which there was a contest. Everyone voted on the scarecrows. We had a picture booth, well, a picture
Backdrop,
screen.
yeah.
that the library would take your pictures in your costumes, and it was posted on their Facebook page. We had free library books that were donated to take. We had a coloring station where you could, take some coloring pages, Halloween. We had 3 different games that they could play. The fire safe house was here. The kids could go through the safe house. We had a blow-up Halloween house that they could walk through.
A little spooky house.
Little spooky house. It
That's
was
cute.
It was
great,
cute.
Michelle. We were able to purchase that this year. That was amazing. And we had s'mores over the fire pit. And then they were making, we made hot dogs in the senior center, which has a food permit. I'm serve safe. Don't worry. We abided by the rules. And we brought the packages upstairs. They were in the little silver. We put the hot dog in a little silver package thing in a bag with a small bag of chips and a juice box. Or a water. They could choose a juice box or a water. So we'd bring them up just to keep, normally in years past, it's been in the senior center with the coloring, and then there'd been a craft down there, but we kept it outside, not wanting to have gathering inside. We figured keep it outside. It's better. We had,
How many kids? 'Cause
I think,
was
like
trying.
150, 160, somewhere there.
Oh, that's
No,
not
no,
bad.
normally we
Yeah.
have like over 200.
Okay.
Which I understand, some parents probably didn't feel comfortable or it conflicted with different things, and that was fine. But it was great. It was great to see the kids.
We had a good time.
We had a very good time. Lots of fun. I look forward to doing that again. To saying that, we are in that's all coordinated through the selectman's office. Michelle spearheads the whole thing. She does an amazing job. She did reach out to Roe regarding the upcoming Christmas.
Tree lighting.
We do a tree lighting. We did not do the tree lighting last year. We just did Santa and the Grinch drove around on the fire trucks. They will be doing that again this year. They announced that last night
great.
at the selectmen's meeting. That'll be done on the Friday after Thanksgiving, starting around 4 p.m. The tree lighting we do here, and it's, we light the tree, Santa comes down on the fire truck, kids have their pictures with Santa.
Is that still gonna be that first Thursday?
No, I think it's
No?
been, Michelle's put, she
The
points out
9th,
the
I
9th,
think?
she's
The
aiming
9th,
for.
okay.
So I talked with Michelle, Roe talked with Michelle, different ideas, basically trying to keep it outside again. When we do pictures with Santa's in the police station lobby. They come in through the police station door, they wait outside in line. This is how it's been in years past, so that's not changing much. They can come stand next to Santa. It's not gonna be more than 2 minutes, 3 minutes, 4 if it's a bad, a tough. And then they're gonna go out through the police station lobby into the main lobby, where we'll have a table set up. We usually get all the pizza areas in town donate pizza. So what we discussed doing was, Ro had told Michelle, and Michelle told me, I thought it was great, putting the pizza in little,
I don't know, what are they called? They're like
The clam
parchment
shells?
paper bag
Oh, yes.
envelopes,
You
not
know,
envelopes,
put your
sandwich
piece-
bags.
Yep.
having, hot chocolate or hot cider for them to go. Their craft, we usually do a little foam thing from Oriental Trading, so they're already prepackaged. Giving them their craft, when they see Santa, they get a little goodie bag. And then sending them back outside. And if we can find some activity, we're looking at maybe an activity outside or something.
Yeah.
But figured we still wanna do it, but we don't wanna gather inside because
Right.
that would be the worst thing
Yeah.
that could possibly happen.
Yeah, take home.
You know,
Yeah.
come through, so you won't even be in the town hall for 15 minutes. You'll be, moving right along.
Right.
Yeah, it
So,
starts with the tree.
Yes.
Right? Santa comes, they light the
they
tree.
they sing songs around the tree. So it's a nice event. We have fun at it. In years past, we have a cookie decorating station. This year it will be, here's your cookie, go decorate it at home. In the senior center, the people would sit and have their pizza and socialize, but we don't want to have that with a larger crowd,
Yep.
Just figure that's,
Just one more year, right?
that's what we're, and at least this way, we're still having it. They can still have their picture with Santa. If they don't want to have a picture with Santa, they don't have to.
Right.
They can still just walk through and have a goodie bag. That's, we're not, by no means would we force anyone, but if somebody wants to,
Mhm.
But we're gonna have the Shepherd Hill Craft Fair with 150 vendors. That's exciting.
Yep.
Inside the school.
Yes.
That's great. I think that's gonna be nice to have some people back in there and
Yep.
help those vendors out.
Yep, it should be
Yeah,
crazy.
it'll be good.
It should be
Cut-
crazy.
You know, a lot of self-employed vendors are looking forward to that, having people come and purchase things for the holidays.
Shepherd Hill Craft Fair, which you've never had, probably
it's
never had the
big.
pleasure of. You will, huh? And I'm sure that's where a lot of the vendors are.
Yep.
It's a huge craft fair.
Mm-hmm.
They did do less vendors this year, I heard, only 150 or so.
Okay. In the cafeteria, the
Throughout
gyms,
school. Yeah.
and the halls down the school. So I know I don't know if it'll be you inspecting them or if
It
we'll
will
have
be.
somebody else, sorry.
That's fine.
We'll get you there early
Yes.
Yeah.
so that you get in and out, and if you have concerns, you let us know by all
Sure.
means. If
Okay.
that's the 20th, right?
Yeah.
Yeah.
If I'm around, I will
It's
touch
a
base
good
with you
day.
beforehand, and
Okay.
maybe I'll meet you up there, or
Sure.
I don't know if you
What's November 20th?
yeah.
Yep.
I mean, if it's early in the morning, I
Yeah,
don't
the
have an
event
issue.
starts at 9, I believe. It was listed as 9 to 4 in their
Right,
applications.
right.
Yeah.
I mean,
It's
they've
busy
had
early.
lines
Yeah.
Mhm.
and parking,
Mhm.
Yep.
yeah, it's, so, but we don't want the town hall to be the breeding place of anything.
Mhm.
We just don't think it'll
Yep.
look good for the town to be.
Right.
Think it's great that things are happening, but I just don't want, she doesn't need to get the phone call and have it,
Yeah.
oh, I got it at, that just,
I mean, I know the mandates are gone, I get it, but I don't know.
this way we still have the event, we're
Mhm.
not canceling it.
Yeah.
We're just not having people sitting and eating pizza,
Mhm.
Right.
but we're working on, Michelle's working on an outdoor, something for the
That'd be
outdoor
good.
event.
Some type of entertainment.
Yeah.
And I think she had questioned or asked some questions about food trucks as a
Yes.
possibility.
Yep, so we're working on different things.
Okay.
Well,
That's cool.
just to make it exciting,
Yeah.
so. Do you have any public comments?
Nope, thank
I
you.
mean, board comments, sorry.
No.
We need to determine our next meeting,
Yep, that's one thing.
because we get all thrown off during the holidays,
Christmas.
because it becomes hectic. So normally our meeting would have been next week, right? Third Tuesday of the month?
Mhm.
It's been a while. So if we do that, no,
Oh, Christmas.
nope, we're not doing it on the 21st, sorry. Nope,
Should we-
I'm supposed to be on vacation that week, so.
I think that's my last day of my class, so I will not be attending.
No, and that's it, we're working around
Yep.
Rose and Lori, we try to
Sure.
be accommodating.
I mean, 4 weeks from now is the 7th, is that too soon? Or I could possibly do the 7th, otherwise we're looking at
Is there
like.
something on the 7th? No, I don't have anything on my calendar, but why do I think?
I don't know, it seems weird.
Doesn't it?
Do we have a need? Could we be on standby, or do we have to?
Well, in years past, in December, we've not held a meeting just because, but we've always been of the, if something came up where we
Yeah.
needed
Yeah.
to, we could pull something together within 48 hours,
Okay.
the best we can.
Right.
Do you feel, in our current situation of everything, do you think that's a problem?
I don't anticipate that being a problem.
Okay,
So we'll just leave it as a question mark?
Right,
If
so-
we need it on the 7th?
we'll just, yeah,
Right.
we won't. But let's look at January.
Right, like, maybe should we consider doing it that first Tuesday because we're skipping December, or at least do it
Absolutely.
the 11th?
Let's
You
do
know?
it the 11th,
Okay.
just because that first one, it might not be just right
Oh,
after the
yeah,
holiday.
that's true, we might not have a chance to get it posted.
Is the 11th good of January?
right now, I think. So I might be a little bit late, but that's a longer day for me, but I will try my best. So Board of Health.
Little bit late as
Just a
in-
couple, like 10 minutes.
Okay, no problem. Well, we'll put 4:30, but if we don't start till 4:45,
Yeah,
that's okay with
yeah, because I have
everybody?
standing clients, so,
No, that's fine.
okay.
So let me put it in my calendar.
If I can get her to pop in a little bit early. She usually comes a little early, so I'll do my best.
I can't believe we're talking about January
know.
already. Oh my goodness.
Yay.
I don't think I have anything else to say. So,
I don't believe so either. You good, Lori?
I'm good.
All right.
okay, so I'll entertain a motion.
Make a motion to adjourn.
I second that motion.
I have a motion to adjourn and a second. Any other discussion? Seeing none, all in favor?
Aye.
Motion, meeting adjourned at 5:20.